Hello, my name is Christina Koulouglioti and I'm a Senior Research Fellow at Western Sussex Hospital's NHS Foundation Trust and at the Research Centre for Transcultural Studies in Health at Middlesex University. I would like to take the opportunity to thank and acknowledge Professors Irina Papadopoulos and Antonio Scorbisa, two of the chief investigators of the CORESIS International Research Project on which this presentation is based upon. The purpose of this presentation is to describe the theoretical underpinnings that guided the development of the innovative AI technology of the CORESIS project, a technology that focused on cultural competence and aimed to develop a culturally competent, socially assistive robot. There are many robots currently available, and these robots take different shapes and have a variety of capabilities. Our project focused on socially assistive humanoid robots, which are special in the way that they interact, and the key word is social. These robots are designed to provide assistance through social interaction, using, for example, different gestures, speech, and movements. However, the goal of the project was to develop a culturally competent robot. There is a lot of debate about the use of robots, especially in the care of older adults, but if we want robots to be accepted and effective in the real world, it is imperative to recognize that we need to account for the cultural identity and diversity of the user and, of course, the healthcare team. But why culture? Researchers have identified that culture is a very important factor in the interaction between humans and robots. Our integrative review of the literature has found that our cultural background influences our attitudes towards robots and our acceptance, or not, of robots. In general, we know that the closer a robot can act to a user's culture, the more welcome is the interaction. Now, how about nurses? When it comes to nurses and healthcare professionals and their views about robots, what we know so far is that despite the media attention in relation to the workforce implications of using robots in healthcare, nurses do not tend to worry that their jobs are in jeopardy. They do have, however, mixed views and feelings regarding the use of robots, but they're not all negative. On the contrary, they can think of an array of tasks that the robot can be useful, for example, assisting in the monitoring of patients. And at the same time, they raise concerns about the patient's privacy, confidentiality, infection control, and safety. Now, what did the CARESIS project aim to do? The CORESIS project aimed to develop technology so that robots can act and communicate in a way to match the culture and custom of the person they are assisting. However, the goal was not only for the robot to just recognize the user's culture, it was also important for the robot to exhibit elements of a culturally competent behavior and avoid stereotypes. A very difficult task indeed. The project utilized existing theories and at first utilized the critical elements of the Papadopoulos, Tilke, and Taylor model of transcultural health and cultural competence. The model has in its heart the notion of compassion and describes an essential cycle that starts from cultural awareness, moves on to knowledge, sensitivity, and then competence. As we all strive to be culturally competent in our interactions with patients, family members, and colleagues, it was considered imperative that similar principles should guide the robot's actions and behaviors. We then utilize the well-known work of Hofstede and the cultural dimensions. Through Hofstede's work, we know that people from different countries have different perspectives and values, and these values influence their behaviors. And of course, we cannot ignore them. On the contrary, these first cultural dimensions can serve as a starting point when we try to understand people from different countries. Finally, we expanded our notions on the cultural iceberg, thinking of how Hofstede talks about the visible and the invisible cultural behaviors. We were very much interested in capturing the way that a person's cultural background influences their reactions. We thought of how everyday triggers, such as receiving bad news or good news, affect a person's feelings, and how that translates into an observable behavior, which could be different for people from different cultures. For example, an Italian or a Japanese person will express their sadness or happiness in a different way, and it was important to pay attention to these small differences that can occur in daily interactions. The combination of this theory led us to the creation of the Adore model, a major innovation for the Caresses project, which aimed to guide the robot during its interactions with humans in such a way as to avoid stereotyping assumptions and behaviors. The Adore model identifies the following components as important for a culturally competent behavior. The robot needs first to assess the situation with cultural awareness, knowledge, and sensitivity. It will then move on to do, perform an action or any actions that are required, but with dignity and cultural compassion. It will observe the enactment or implementation of the user's actions, always with cultural awareness of the visible levels of behavior. Then it may need to revise any actions, but in partnership with the client. And at the end, it will need to evaluate the impact of actions, taking into consideration ethical principles. Having the theoretical framework in place, we followed a very detailed methodology to develop the programming robotic guidelines. The Coresis project focused on older adults from three distinct cultural backgrounds: English, Indian, and Japanese. We started with the development of multiple stories, then ontologies and scenarios, capturing in every step cultural details that they were very important to be incorporated in the robotic guidelines. We followed the creation of scenarios with actual observations of older adults in the UK and Japan. The robot aimed to interact with older adults in the UK of English and Indian heritage and with older adults in Japan. Therefore, we observed and videotaped older adults in care homes in the two countries. We videotaped and observed their day as it was naturally occurred. We observe their interactors, their reactions and interactions, and then, in order to validate our observations and interpretations, we ask external experts to provide their views on the same videos. Based on our initial findings, we created a set of guidelines that robotic engineers use to program the humanoid robot. But before we actually use the robot in clinical trial with real users in care homes, we created short clips of the robot interacting in a culturally competent way, and we asked older adults to evaluate the clips online. Based on their feedback, we further refined the robotic guidelines, and we were ready to test the new technology with real users. Without getting into many details, the evaluation happened through a randomized controlled trial. Older adults were recruited and randomized in three different groups in the UK and Japan. The three groups were as below. The One group received the culturally competent robot, another group of older adults received a controlled robot, and the third group received usual care. What we found was really, really interesting and important. Older adults in care homes who used a culturally competent robot, and they had the opportunity to interact with the robot over a 2-week period for about 18 hours. Across the 2 weeks, they had a significant improvement in their mental health. A very positive impact of the interaction was on their severity of loneliness, and another positive impact was on their attitudes towards robots. Now, closing with a few final thoughts, I would like to say that this is a very new and exciting area of work. It brought together different disciplines, and we all work together collaboratively to create a very new and exciting technology. And in my view, it is very important for nurses to be involved and play a very significant role in the development of such technology and future healthcare innovations, especially robotic innovations. I would like to thank all of you for listening, and I would like to thank the Coresis team and encourage you to visit our website to learn more about the project. Thank you very much.